Hello and welcome to yet another session of Aspire to Inspire, where we share some unheard, untold, inspiring stories. And today we have with us Dr. Apeksha, all the way from London, UK. She's an NHS dentist, my dear friend, and a cancer survivor. She's an epitome of optimism and buoyancy. She not only battled cancer and many other medical conditions, but triumphed over each one of them. Welcome to the show, Apeksha.
Thank you, Garima, for inviting me. Such a good talk.
Please tell our viewers what is lymphoma? I think you were diagnosed with stage 4 lymphoma. So, what exactly is lymphoma?
So basically, it's a cancer of lymphatic system. So there is we all have got a blood vessels and blood. Similarly, with blood, there is another vessel attached, which is lymphatic, which has got all the wastage, you can say, or it basically balances our immunity. So what happened? I got kidney transplant 10 years ago. So my immunity is quite low now because I take medicine which keep my transplanted kidney in my body in a good condition. So because of my immunity was low, there is a virus which normally you find in everybody's body, but in my body, continued increasing because my immunity was low, and that created that lymphoma.
Right. Thank you so much for sharing that. Before we continue any further, let me share with the viewers all the different conditions that you had, the timeline of these medical conditions, so-called your medical chart. So at the age of 12, you were diagnosed with nephrotic syndrome, right? It is a kidney disorder in which your body tends to excrete protein in urine. And you were too young at that time, 12.
Yes. I didn't even know what's going on with me. All I remember, my parents taking me to hospitals and I'm going through blood tests and so many medicines I have to take, and my parents telling me to take precautions.
And then it was chronic anemia and vitamin deficiency. By the time you turned 19, you had psoriasis, which is again an autoimmune skin disease, right?
Yes, exactly. So it was all related to my immune system, I realized, because even the kidney disease, nephrotic syndrome, is an autoimmune disorder.
And at the age of 28, you had hypothyroidism. At the age of 30, I mean, at a young age, you had kidney failure, right? You were on dialysis and then kidney transplant. So who was your kidney donor?
My husband.
Wow. So this is what is known as true love.
Kidney was not matching. So there is another treatment they had to do in my body, which is called plasma therapy, to remove body against his blood group. Okay. So that at that time when I had the operation, at that time that was very new in India. I had my surgery in Medanta Hospital, and it was very, very new. I was, I think, second or third person to go through that treatment. And I saw there was one guy who even couldn't survive that treatment. He just lost his life in that treatment before even reaching to transplant surgery. So I don't know how I survived that also. And then we both went into the transplant surgery.
That must be a courageous decision to take, right?
Yeah, it
was. To go ahead with this particular treatment.
Yeah.
Right. And then at the age of 35, you were diagnosed with gastropathy. What is gastropathy?
So it's basically because of all these medicines I'm taking since the age of 12. It's like almost morning and night I'm taking 12, 15 tablets, different types of tablets. And they all caused such a, you can say, acid in my tummy that I got that issue that, whatever I eat, it doesn't digest well.
Right. So tell me one thing, after having been battling so many diseases and eventually trying to improve, finally when you got to know that you have stage 4 lymphoma, What was your reaction to it?
My lymphoma was in my tummy. Two were in liver, two big in liver, and one was in stomach. Yeah. Okay. So basically, I started getting dull ache in my tummy. So that was the time, like June 2020, where everything was like in lockdown. Whole world, like it was all in lockdown. And doctors were not even treating for basic emergencies. And when I'm calling them saying that I have got dull ache, they were not taking me seriously. But then that pain continued and continued. So I went to emergencies and they admit me. And for 3 days, they continued doing tests. Nothing, they couldn't find anything. They were not able to see anything in my blood. I was not having any temperature. There was nothing. So I kept on pushing doctor. I mean, they were big renal consultant, big doctors who were doing my test. So I kept on pushing them, please do it, please do. There is something. They thought I'm just making something myself. So then when they got the report of MRI scan and they found out those lumps, and they were like quite shocked, and they told me. So I still remember when doctor came, and I was all alone in the hospital because COVID time, nobody was allowed, nobody from my family, friends, anywhere. So I was all alone 1 week, struggling with pain and doctors. And when doctor came and told me, you've got, so first he told me I've got liver cancer. And honestly speaking, my reaction was, thank God you found something. Yeah. That was my, I didn't feel anything like, oh, what happened to me? Oh my God, this. And I was like, thank God you got something. I told you there was something.
So the first thing where patients struggle is acceptance. And that acceptance was there in you from the very moment you were told. So that was one thing which was positive. That somewhere I think helped you. That positive mindset helped you even in the treatment, right? But then there are side effects to chemotherapy. How did you feel that? See, going through a disease and getting it treated is one part of the disease. The other part is about these side effects. So how did you go about this?
I still remember when before going for the chemo, the doctor gave, so doctors email for those 3-4 pages of consent form, which containing all the side effects of the medicine. I didn't read. Okay. I didn't read. I went to the appointment and I asked them where to sign. She again asked me, did you read? Are you okay to go ahead? I said, in my life, I always work towards the solution. If according to you, that's the only solution, then whatever the side effect, I'm okay. I have to move on. I have to take this. And when I took that, when I started with chemo, then I knew all the side effect will be coming. So I was thinking in my head that these side effects are good because even if I'm losing my hair, okay, maybe look-wise, I lost my confidence. I won't deny that. But somewhere I knew that this is for my good. So I continued working normal. I kept on going to my clinic, treating patients and doing housework. I kept on doing everything because I didn't want to make myself feel vulnerable or a victim that, this is all going on. So those chemo side effects didn't get on me too much on my mind because I continued living as a normal life and took the chemo as a treatment, not as something very problematic. And however, the chemo side effect stays for like many years, 1-2 years. And it's exactly 1 year now. Last year I was going through chemo, exactly 1 year. I still experience a lot of side effects, like hair loss is very common, but then mentally lots of side effects you get. And my periods got very irregular. Doctors are saying that I may be going through early menopause, which is not good for my heart. So now they are checking my heart regularly. So lots of things going on. It's not easy. But what I always keep in my mind is don't take anything too serious. It's all, I think I got this courage. I would like to mention today, I got this courage from my mother. Wow. She has been a big, I can say, role model to me how to live life the way you want with all the adversity you have got.
Right.
The reason I'm mentioning her today, I lost her yesterday.
What?
Yeah.
Oh my God, I'm so sorry.
It's all right. It's okay.
Oh
It's
my
okay.
God.
It's okay. I could have said no for this interview today, but the reason I'm saying, because I know that's what she wants. She has always stood for strong women. She always stood for women, always. She was the head of Mahila Mukti Morcha and women empowerment. So I know this interview you wanted to do for women, to give them a message that we are strong and we can fight through anything. So I decided to continue with the interview today.
I'm so sorry for your loss, Apeksha. In fact, when you were telling that your mom gave you that courage, and I thought, I'm sure she would be happy to watch this interview. So that was what's going on in my mind. I was thinking over that she would be super proud. And then you
She'll
told me this.
be watching from somewhere,
Yes, I'm
definitely.
sure. And she must be really proud of you. Really.
So yeah, we lost her at, like, she was not that old. She was just 60-year-old, and she was such a great woman. She got burned full 75% at the age of 1.5-year-old, and she survived. Then she had an open heart surgery. Her valve completely stopped working at the age of when she was 30, and she always continued working hard. She was not very much literate, but she continued working, and she made her own name. Like, people know her because she fought that Vidhan Sabha election at one time, and she worked with BJP, and she was the leader there. So she continued showing people that how you can stay strong. Just continue, just try. So that's what my message to all the women that thinking, oh, I got this problem, I got that problem. I understand health issues are not easy to deal with because your body, your body is weak. But if you are mentally strong, if you keep your mind strong and don't let that victim feeling get into you, then you can do anything. And one more thing, stop listening to others. In my cancer journey, I didn't tell nobody, what I'm going through. After I finished, I got cured. I told. The reason, if I would have told anybody, they would have told me, they would have showed their worry, which worry could have come to me. So my point is, don't listen to others, listen to what you feel.
Your inner voice. Let your inner voice
Exactly.
guide you. Right. So somewhere I would say this fighter, this warrior spirit runs in your family, it runs in your blood. And somewhere it
Yes.
does show off. It does
Yes.
show that how strong you are. So it would be wrong to say that you are an embodiment of grit and perseverance. Thank you so much, Apeksha, for making it today, especially after what happened yesterday. That shows that you are a true mirror image of your mother. I'm sure she would be proud of you from where she is watching. Wishing you good health and happy life. Thank you so much, Apeksha, for being here.
Thank you. Thank you, Garima. Thank you so much.
Apeksha has definitely proved that victory is always possible for a person who just doesn't stop fighting. Leaving you all pondering on this, this is Dr. Garima signing off for now. See you in the next episode.